and then to pass it on to Leslie for her update. Katie?
Okay, thanks, Contain. I can't change my hat fast enough in terms of the description on the screen, so I apologize. But coming back into my GFAN hat, everyone, we do have, as Contain mentioned earlier at the top of the call, we do have two other areas that we wanted to quickly sort of touch base on, provide some information and some understanding from our side, and make sure that we have opportunity for discussion. So because it's an exciting month, there's lots of other things that colleagues are preparing and working on at the moment, and the high-level meeting on HIV/AIDS, which just sort of recently, I think it was yesterday, put out, for those of you who are following it very closely, I think it was a third version of the political declaration. And so there have been at different moments over the last few weeks, opportunities for civil society who are sort of really heavily engaged in the nitty-gritty of it to share thoughts and feedback with member states around some of the language that's there. I think Leslie will do a better job of it than I can, because I see her looking at this very closely and working at this very closely with colleagues across civil society and communities. But just to say, I think there's a significant amount of concern at the moment. And for those of you who are able to join the call that was convened by a number of allied partners last week, there's a significant amount of concern about some of the setbacks in terms of the language, which sounds like something that isn't as important as the language and the norm setting that UN high-level meetings do is really critical in terms of the impact that it has in the broader sort of ecosystem of how we talk about HIV/AIDS, or how we have talked about things like tuberculosis or universal health care or pandemic preparedness with these kinds of UN-led processes. So Leslie, who leads the work on the Unitate Advocates Network, is going to run you through an update around the high-level meeting, and then we'll open it up for discussion. So Leslie, over to you.
Great. Thank you so much, Katie. Thank you, Quentin, and thank you, everyone. So as Katie mentioned, my name is Leslie Widdendal, and I'm leading the Unitate Advocates Network. For those of you who don't know the Unitate Advocates Network, we're a network of communities and civil society who are doing advocacy for resource mobilization for Unitate. So similar to GFAN, but for Unitate. And if you would like to join, please pop your email in the chat so we can add you to our listserv, and it would be happy to have you. And sorry for that punt, but I'm recruiting members wherever I go. Next slide, please. So in terms of the high-level meeting on HIV, just as a reminder, the reason why we're focusing on this as UAN, but also GFAN and other organizations, is because it's really the highest level of decision-making that happens, in the sense that at other global health institutions, if you think about the decision-making and the boards, there's usually only some member states that are part of the process, whereas in this process, it's all member states in the UN system. It is taking place next week, Monday and Tuesday. And I think, so the outcome document, some of you may know this, and so sorry for the repeating, but the outcome document is what's called the political declaration. And it outlines what member states commit to for the following 5-year period. And in essence, it's a way of formalizing the global AIDS strategy. And one thing I will say before I get into the details is that usually the process pushes for consensus. And so what happens is in the negotiations, sometimes you'll see some watering down of language to, appease different member states. And usually it's, by consensus, but we feel that this time it will very likely go to a vote. So in terms of the key dates, as you can see, it's been an important week. As Katie mentioned, Revision 3 was released on Monday evening, and basically put under what was called the silence procedure. So this is the 24 hours that member states have to basically either accept the text that has been circulated by the co-chairs or to break the silence and to voice their concerns. And we were not happy with revision 3, and I will go through in more detail because there was a lot of undermining of community-led responses and key populations. And a lot of member states were not happy with the text. The EU, UK, Brazil, Japan, Switzerland, and Colombia all broke the silence. It's not clear to, it's not known on each of like the areas that they were unhappy with. But basically what happens now is that the co-chairs meet with all the different member states. They have bilaterals and try and discuss the concerns and see if they can come up with any language that addresses those concerns. And so for us, really, the next steps are unclear. All we know is that this afternoon, New York time, the co-chairs is having the bilaterals with different with all the different member states who've voiced their concerns. And then next week will be the actual HLM held in New York, where there will either be an adoption of the political declaration, or there'll be the voting on and then the adoption. Next slide, please. So in terms of just to highlight, and also there's actually a call happening right now on strategizing around the next steps. And I just want to give a huge shout out to that group for doing amazing work led by Shannon Kowalski, who's doing work for AIDS funds, because they've really done a lot of the heavy lifting. And just to show that we've been really engaged throughout various civil society and community groups, there's been the National, Regional, and Global Consultation. There has been the Multi-Stakeholder Task Force, which is a task force made up of representatives from different areas of civil society. And we have the co-chair on the call with us, Priscilla Ama-Adu, and many other GFANers that we know were part of this task force, and they've also done incredible work. There's also been a communities and civil society priority document. And then what's happened is that after each revision, a small group of civil society have been coming together and saying, what are our red lines? What do we want to include? And what needs to be taken out? And there's also been this rapid response meeting that Katie mentioned. Next slide, please. I'm getting aware of time. So in terms of our key concerns, I think reading revision 3 was a bit of a punch to the stomach. A lot of the human rights language has been weakened. What they've done is where they've said, for example, that they reaffirm the previous political declarations, they've put in this phrase that says as appropriate at the end. So I think it gives a loophole for member states to say that, they don't recognize these things. A lot around community-led responses has been weakened, around participation, but importantly around financing. In the previous revisions, there was good language on financing community-led responses, and that has been deleted. Very shockingly, the references to key population have been reduced or changed in several places, but most concerning is the definitions of key populations. They have said that, for those of you who aren't aware, key populations are men who have sex with men, sex workers, people who use drugs, transgender people, and people in closed settings, such as prisons. And then when we talk about vulnerable populations, that is different according to different countries and different settings, according to their epidemiological context. And what this reference to key populations has done is they have said that instead of this globally recognized, those 5 groups are definitely key populations, they have said that countries can decide for themselves who their key populations are. And very concerning, the definition has been limited to these are the groups most at risk to acquire HIV and to transmit HIV. So completely stigmatizing, discriminatory language, reducing key populations to the recipients and transmitters of HIV. There's also been as you know, gender equality and SRHR language has been reduced, and so we're a bit concerned about that. Next slide, please. I would say we've had a few wins. There's good language on access to medicines, health technologies, innovation, market shaping, technology transfer, and local manufacturing. There's a lot of talk on integrated health systems, including integration with TB, non-communicable diseases, mental health, and primary health care. And there's strong language on advanced HIV disease, continuity of care, and long-acting HIV prevention and treatment. Next slide, please. And so really the question is, what can you do in the next few days, leading up to Monday, essentially? We encourage you to engage your member states that you maybe have a relationship with the missions in New York, and reach out to them. Sorry, I think I made a mistake there, but basically reach out to them and encourage them to focus on the key civil society red lines around human rights language, community-led responses, key populations, and gender equality. Encourage them to keep supporting the amendments that protect these. Given that it's very likely to go to a vote, there is still time to pressure your governments to address these issues if it does come to a vote, to support on these issues. Next slide, please. I think it's my last slide, which is just on a few, thank you, Katie. They popped in the chat. The Civil Society and Communities Priority Document by the Multi-Stakeholder Task Force is there. There's also an advocacy brief on actions that you can take, even if you won't be in New York. And please do let us know if you will be in New York, because there's a group of people who will be there and to coordinate. And then I also just provided revision 3 of the political declaration for your interest. Thank you.
Thank you, Leslie. Really appreciate you running through that quickly. It feels like every conversation around the HLM, because of the timelines, everything has had to be really, really quick. And I think it is super impressive that as civil society, there have been some colleagues from, as you mentioned, Shannon, from Frontline, others who are really leading and driving some of this work behind the scenes to make sure that even if it is really quick, that we are still able to share out resources and pool our thinking together. So thank you for that, Leslie. Appreciate you bringing that here. I've just opened it up to see if there are any questions or comments, and noting that those resources, the links to them are in the chat. So I'm just looking to see if there are any questions. I'll take a look for hands raised if you can find that, or if you would like to use the chat. So I think if nobody else has a question, I think I would just ask Leslie, in terms of one action, this meeting is taking place next week. If there was one action that colleagues here on the call did before then, what would you suggest that they do?
My suggestion would be writing to your missions in New York, and saying that you're concerned about revision 3. These are your key concerns, and asking them to hold the line as the meeting unfolds on Monday and Tuesday. And Cecilia, I believe, will actually be in New York as part of the Ghana delegation. So all the best, Cecilia. I think it's going to be a tough meeting.
Okay. Thank you, Leslie. Cecilia, did you have any comments? I didn't mean to cut you off.
I shared it that we have submitted letters already. GFAN Africa drafted a number of letters And so we send them to our mission and also to our ministers here in Ghana. And so we are hoping that, and there's a number of advocacy activities going on and engaging even the MPs who are going. So we hope that something positive will come out from it. Thank you.
Thanks, Cecilia. And Leslie, I'm just noting a question, a late breaking question in the chat from David Bryden. And I don't know if you want to try and address that from your perspective around if the right language on key and vulnerable populations is not in there. Is it better to not have a declaration?
To be honest with you, David, I think the risk of not having a declaration at all, that's a very, that would not be very good for us, especially as, the world is moving away from focusing on HIV specifically and more towards, primary healthcare and integration. It's really important that we get some kind of declaration. This is just my personal opinion. I think the fight is to get the best language in there possible, and I think there's enough support from member states for that to happen. But anything is possible. It's been a very strange HLM.
Thank you, Leslie. Thank you. And thanks for the question, David, Cecilia, for your comments. And just again, just noting those documents, the links are in the chat, and also seeing one of our colleagues, of course, after these calls, we'll pop the link into the chat here shortly, but we do always upload our presentations that are shared on the calls as well as the recordings, so that you are able to you're able to access them after the call. So we will do that, but please do try to take note of the links of the resources, because it can take us a little bit of time. And as we've said about the HLM in particular, time is of the essence. So I would like to move on, and I do see another question popping up in the chat, and we'll address that in the chat here, Valentine, and other colleagues who are putting in comments now. But let's move on in terms of our agenda about the International AIDS Society Conference, or the AIDS Conference, that is taking place towards the end of next month, July, so already only just a little over a month away. And I'm going to pass it along to my colleague Rita, who has been leading our efforts as GFAN to get ready for that conference and to be ready to both support all of you with the work that you're doing, as well as give you and share with you opportunities for discussions and conversations around key important issues. So Rita, over to you.
Thank you, Katie. Hi, everyone. So my name is Rita Zawi, and as Katie said, I'm leading the IAS coordination, the GFAN's coordination in IAS this year. So quickly, IAS is the largest gathering on HIV in the world. And this year it convenes from the 26th to the 31st of July in Rio de Janeiro, Brazil, and virtually as well. So let me walk you through what we'll be doing. First, we'll hold a pre-meeting on Sunday evening at the Windsor Marapenti Hotel from 5 to 8 p.m. This pre-meeting will aim to connect us together and get our bearings before we dive in the very clinical and very impressive world of the IAS conference. If you haven't already, you can RSVP to the pre-conference using the QR code on the slide right now. And one important thing to keep in mind is that our colleagues from ITPC Global and IPPF and Gestos pre-conferences run the same day at Rio Centro, the conference venue. So let's try to plan our Sunday accordingly. And then during the conference, we will have headquarters, the networking zone in the Global Village. It's our central gathering point. And you can come participate to our sessions. Maybe we can help co-host with us some discussions and think together. But you can also find friendly people and good advices on where to find free coffee, because it's often a little bit hard. So what we will want from our networking zone would be like unity, because we will sharing expertise, because we will have a program of 4 sessions per day, and advocacy, and that's very convenient because that's exactly the 3 pillars of our strategy. But we will discuss more specifically some of the hardest questions that are happening right now, like set aside, the impact of the funding cuts, transition, social contracting, and all this will help us to work after the Rio Centro. And since we will be in Rio, we might dance a little bit too, but that's a surprise. And like to be like more seriously, we are right now building some session with some of you, and we will build some other sessions with some others from you. So to highlight our town halls, one with the secretarial leadership, Françoise Vanni and Izu Kanji Sikazwe, and I'm sorry if I mispronounced, and one with Javier Hurkat Belloc, so same sorry. Those sessions will probably be accessible remotely for our colleagues who might be not able to be there for a lot of obvious reasons. And if you'd like to put a session together, or that we host one of a conversation, you can reach out to me. I will drop my email in the chat, and we will be glad to have you with us, and we can't wait to see you in Rio.
Thank you, Vita. We're going to open it up for discussion, and also to welcome colleagues to share any sort of announcements or information that you have around what is taking place at the conference. Vita, I just flagged for you, there was a question for clarity around the specific pre-conferences that you mentioned that overlapped, which I had a slightly snarky remark that many of them do. But I think it would be helpful if you could repeat the ones that you had mentioned in particular when we come back to that. But it would be great to hear from all of you, even if it's still early thinking in terms of some of the activities that you are all planning in terms of at the conference. We will, of course, as well, I guess I shouldn't say of course, but we will be sharing sort of a guide, as Vita mentioned, to both free coffee, where to find water, but also, you know, some of the key sessions. And for those of you who aren't attending, there are still in person, there are still opportunities to watch and participate virtually in some of the core conference sessions, as well as I'm sure some, you know, networking zone sessions or workshops or other sort of satellite sessions. And so we do try to gather this information from all of you to make sure that we can, you know, share a bit of a guide and reminders as we get closer to it of some of the key sessions that you might like to see colleagues attending that you may be organizing. So again, I'm just going to pause for any questions, but also for any announcements or information that any colleagues would like to share about their activities coming up at the Rio IAS conference. So I'm seeing a few. I'm seeing one from Anil about Gates networking zone. It would be great if others have information about other networking zones. I know we've heard ITPC has one. I've heard of a number of other ones, which for some reason has just escaped out of my head. But this is your moment, colleagues. So please do raise your hand and or use the chat to let us know some of your activities. So Vita, would you be able to clarify? Did you do that? You did that in the chat.
Yeah, I did that in the chat, but it's not an overlap per se. But the same day, on Sunday, our colleague from ITPC Global and our colleagues from IPPF Latin America and Gestos are having their own pre-conferences in the venue of the Rio Centro, the conference venue. Our pre-meeting is at the end of the day, in another place that's not very far from the conference venue, and that's accessible with the official conference shuttles. I hope it's clear.
So thank you. It is always a busy time with the many different sort of pre-conferences, Vita, so thank you. And just opening it up to see if there are any hands raised or any other interventions, colleagues. It's a quiet bunch today, which hopefully doesn't mean that this hasn't been helpful or useful as we try to speed cover all of these different topics. But I see Leslie's hand raised, so I'll go to her. And I would also invite colleagues to continue using the chat to post and share any information around IAS or any of the other topics. And that goes for the time that we have remaining on our call. If there are any questions that you wanted to come back to around the high-level meeting or the upcoming board meeting, we would welcome those now if it took a little while to, if it's first thing in your day like it is in mine, to process some of the information. But Leslie, over to you, and then we'll look again to see if there's any other hands or comments. Leslie.
Great, thanks everyone. So as Unitate Advocates Network, we will have a session where we will be launching our resource mobilization advocacy framework, and also doing like a training clinic. So please look out for details on that. And we will also have a session where we will be meeting the executive director of Unitate, Philippe Dunton. And so that's also an opportunity. I think sometimes there's a lot of mystery around the work that Unitate does. So if you've ever wondered, please do find us and join those sessions, because it really feeds well into the Global Fund work as well. So looking forward to seeing you all in Rio.
So I'm not seeing any hands raised with any interventions. I'm seeing still a little bit in the chat, but I think maybe we'll just wrap up a little early today, and just remind colleagues that our call for applications and nominations to the GFAN Speakers Bureau is live, and you can find that on our website. We'll pop the link into the chat here shortly, and we have been sharing information. We have, asked colleagues to let us know if you're going to be in Rio through a short survey, which I believe is still open, and we can pop that into the chat as well. And we will resume our regular sort of calls in 2 weeks on July 1st. You may or may not see me because that is the day that we get very patriotic here in Canada and celebrate Canada Day, but it may still be a day that I end up working a little, so may see you all on that call, but we will have that call in 2 weeks. So again, Speakers Bureau is live. Looking forward to your information around Rio. We will be coming back following the board meeting with colleagues from the delegations to make sure that we get a debrief and an understanding of what's taken place there. And I can't think of anything else but pause for a moment for my colleagues from the team if there's anything else that should be mentioned. And otherwise, we'll give you back 9 minutes before your next calls or what comes next in your day, friends. So thank you, everyone. Thank you to all the speakers and everyone sharing in the chat different information. Have a good rest of your days. Or
Bye,
good day.
everyone. Thanks for joining.
Thank you.
Take care, everyone.